Mesothelioma is a rare and aggressive form of cancer that develops in the lining of the lungs, or sometimes in the abdomen. It is often linked to breathing in asbestos fibres and is therefore more common in older people who previously worked in industries such as shipyards and construction before the dangerous material was banned. It can take 30 to 40 years from exposure to the disease appearing, and mesothelioma rates have risen by almost 60% since the 1990s. People with mesothelioma are usually treated with chemotherapy or immunotherapy, but options start to become limited once a patient's cancer stops responding, as there are no licensed treatments for relapsed mesothelioma, and currently only 5% of people survive for more than 5 years after diagnosis. Researchers at the CRUK Southampton Clinical Trials Unit and the University of Leicester are looking at whether a targeted cancer treatment could be effective at improving survival for people with this disease. A recent small study called MIST-1 showed that a class of drugs called PARP inhibitors did have an effect against mesothelioma. PARP inhibitors work by blocking a protein which helps repair damaged DNA in cells. During treatments such as chemotherapy, cancer cells are usually destroyed, but some cancers, like mesothelioma, can become resistant to treatment and will repair and regrow. If that repair can be prevented, then the cancerous cells will die. PARP inhibitors have already been shown to improve the survival of patients with breast and ovarian cancers that carry specific mutations. The NERO trial will look at whether a drug called niraparib can have a similar effect for mesothelioma patients. 84 patients whose tumours have continued to grow following chemotherapy will be recruited to the trial. With the help of specialist mesothelioma UK nurses across the UK, trial patients will be monitored to see what effect the drug has on their cancer. If the NERO trial is positive, it could lead to further, larger clinical trials of PARP inhibitors, and hopefully clear evidence that these treatments can benefit mesothelioma patients, giving them more time with their loved ones.